Good morning, everyone. My name is Theethawat Thanawiboonchai. I'm currently a research fellow at Johns Hopkins. I'm pleased to present our research entitled Single Port versus Multi-Port Laparoscopic and Robotic Inguinal Hernia Repair, a systematic review and network meta-analysis. Here are our disclosures. Let's begin with the background. The evolution of minimally invasive surgery has significantly transformed the approach to inguinal hernia repair. Among these advancements, the innovative single port technique, which reduces the number of surgical incisions, has been introduced. However, the benefits of single port approach for inguinal hernia repair remain a subject of debate. In this study, our objective is to conduct a systematic review and network meta-analysis to evaluate the efficacy and clinical outcomes of single-port versus multi-port laparoscopic and robotic inguinal hernia repair. Our primary focus is on evaluating the outcomes of single or multi-port laparoscopic or robotic inguinal hernia repair techniques, incorporating both the tertiary extraperitoneal or TEP and transabdominal preperitoneal or TAP. We have identified 4 primary outcomes for this study: the overall postoperative complication rate, the recurrence rate of hernia, the incidence of hematoma, and the incidence of seroma. Our secondary focus is on operative time for unilateral and bilateral hernia repairs. Here are our inclusion and exclusion criteria. To gather data, we searched PubMed, Embase, Cochrane, and Ovid for articles published before January 2024. After the duplication, we screened 2,912 studies by titles and abstracts. Of these, 130 studies underwent full-text review. Following a detailed review, 93 studies were excluded, most of which had a different control group. Moreover, 11 studies represented by abstracts were excluded because they did not meet our inclusion criteria for outcomes. In total, 37 studies met our inclusion criteria and were selected. Our analysis included 5,038 patients. Of these, the majority of procedures were multi-port laparoscopic TAP, involving 1,860 patients. In contrast, the minority of procedures were single-port robotic TAP, which involved 87 patients. Next, I will share the results of our analysis, comparing them with the multi-port laparoscopic TAP as a reference group. This slide presents our findings on postoperative overall complications and recurrence of hernia. As you can see, all confidence interval for relative risk include the value of 1, indicating no significant differences in the postoperative overall complications or hernia recurrence. Displayed here are our results concerning the incidence of hematoma and incidence of seroma. Similar to previous findings, there are no significant differences in the incidence of hematoma or in the incidence of seroma. This slide presents our results regarding operative time for unilateral and bilateral hernia repairs. As shown, for unilateral hernia repair, the mean operative time for multi-port robotic TAP is significantly longer, with a difference of 10.6 minutes. Other comparisons did not yield statistically significant results. Our network meta-analysis revealed that the risk of postoperative complications and the risk of postoperative recurrence for inguinal hernia repair did not show significant differences among the analyzed surgical techniques. Furthermore, there were no observed differences in the incidence of hematoma and incidence of seroma across the different surgical approaches. These results suggest that the selection of surgical technique can be primarily guided by the surgeon's expertise and the resources available without adversely affecting patients' outcomes. Also, I would like to acknowledge my mentor, Dr. Gina Adores, and our wonderful research team. Thank you very much. I'm happy to answer your questions.